if we were to stop vaccines tomorrow, you probably wouldn't see anything dramatic for a few years. But then as our numbers decreased of how many people were not vaccinated, in about 5 years, you would see the numbers highly increase. And then we'd be reactive, right? Instead of being proactive.
We are so invisible in many sense, because if I am drinking this water right now very comfortably, this is public health.
You never get thanked for the mosquito bite that never happens.
Exactly.
You know?
This is Brewing Better Health, a series from the School of Public Health at the University of Nevada, Reno, where every cup sparks connection and a healthy conversation. Join Dean Muge Akpinar-Elci each month for a cup of Turkish coffee as we pour insights into public health. Today, Dean Muge is joined by Dr. Chad Kingsley, District Health Officer with Northern Nevada Public Health.
Hi Chad, welcome to our Brewing Better Health video series, and thank you very much for being my guest today in my kitchen.
Wonderful, thank you for having me.
And this idea is the Turkish coffee because it's traditional, and I know that you have been in Turkey, so you understand that how the Turkish people see the coffee a little bit different, because it's again not a grab to go kind of culture. It's just more sit and talk and be in the present and that moment, and talk about the life, talk about the stories, and you know, just that. And we want to connect with the Turkish coffee a little bit, the public health right now, what's happening in the nowadays. We want to be more humanized, the public health, who we are, what we do, why we are doing this job. And I know that you don't drink Turkish coffee, so yours is the pomegranate tree, the pomegranate tea, and is again very Turkish too. But tell me about your experience in Turkey.
So I just within the last year was able to go to Turkey, and so this is rather touristy on a little point. They do brew wonderful. But yeah, no, it was just, but that was the community, right? Even when it was part of selling or part of that experience, it was still that was the initial thing they wanted. How do we connect? Even you're not from this country, but how do we connect as a community? And let's do this by sharing this drink. This drink, and let's have our conversations after that.
Exactly.
So I love it.
You're happy hopefully with your tea. And but connecting with the tea, coffee, Turkish coffee, we have a proverb saying that a cup of coffee is remembered for 40 years. You know, for us, you did something very small, but what you did to me is lasting impression, is longer time. It's not just a moment. It's really more than that moment. Do you have that kind of moments in your life?
I do, and I almost think that, and in that, sometimes people don't think we're leaders, but we make a small impact on somebody's life, and they carry it for 40 years. I would love to see how Turkey, how do they develop? Like, how do you go back and say thank you for that moment you gave me that I get to carry for my life? And so sometimes the gratitude of going back and saying thank you for that moment I get to carry. I have a bunch of those, throughout my career. If I had one, I was recently asked, like, what's one thing you've carried with you or a mentor told you? And for me, it was make them tell you no. So, and that went more towards be curious. But, it's always ask questions. To understand what is a system, really what's going on here. But also don't limit to yourself, because it was at a time I wasn't sure if I should apply for a position. And my mentor told me, he goes, make them tell you no. Don't disqualify yourself before that. So I've always carried that. So I'm just like, okay, that's how I need it for my career. Don't put no's in places.
But I love to hear your career, stories. How you started, why public health? What happened?
So I was doing my medical degree, and then as I was waiting for my residency, I got a job working in education and public health, and so that it kind of fell into it a little bit. But when I went to it, after having done a medical degree, I just found that, wow, how much more any doctor should have more of an emphasis towards public health, those points, because it's community. many of our states and stuff were founded on public health for the need of it, and it's really, I just recently told you, I was visiting Turkey and my hotel is right next to public health.
Yeah.
But it brings us together. It's how are we going to live together as a community and how are we going to do it healthy?
Healthy.
And how do we ensure that overall health as a community, individuals are important, but looking at holistically that, our community, and that drives everything from our economy to so many other points.
That is, just a building that community, and also because of the building that relationship is really helping us to hopefully create the more trust. And that nowadays we have a lot of distrust to public health.
Yeah.
So what do you feel about what's happening?
Distrust is just an opportunity to educate, and being transparent, and let's have the conversations, not avoiding them. And, it's re-earning trust or a point. When perhaps it was never earned, but just being able to explain it. So that's part of what we need to do as a community is sitting down and having the conversations. Because if you don't have it, then...
And listening to
and really listening where the point is and stuff. And so sometimes we get a little bit lost in that, because we're advocating and we make an impact on our community, but we also need to listen to everybody.
That is the important part.
Yeah.
But could you please talk about what you do really now?
Yeah, so,
because clinical to move to this side is
to
different.
the side of it is. So medicine
world.
definitely deals with that individual. Public health deals with the community. So it's a doctor sees one person, I try to see 1,000 people, on those points and stuff. So anywhere, there's very specific stuff, and public health is broad. There's a lot of stuff we do. So people know it as our restaurant inspections. We also deal with land and wells and swimming pools and hotel rooms, and also disease surveillance. We have over 88 diseases that we try to track.
Everything.
School health, immunizations, and so we have a lot of points in the community that we really are the ones to measure that and make sure that, we look for trends that make sure to keep us healthy. And can we make an intervention then? And sometimes it's adjacent, you would think that public health wouldn't be part of the Department of Transportation. But if we identify a certain place in the valleys that they have access, that they can't get to a hospital or to a doctor, then do we invest in a system? We don't do it, but can we help invest in a system that perhaps puts a new bus line out there?
Exactly.
So sometimes we want to address the overall system. That deals a lot with mental health too, and different points, and those points are out there. So not necessarily all things are public health, but they're public health adjacent. So a lot of times we try to address the system. So we do a lot. So when I get asked that question, I'm like, it's hard to give an elevator speech on what public health is because it's so much.
And also, I guess is the sometimes main issue. We are so invisible in many sense, because if I am drinking this water right now very comfortably, this is public health. Just if we go to the restaurant and eat, not thinking that we will become sick, this is public health. Or I know that last year we were talking about some budget cut and your mosquito program.
You never get thanked for the mosquito bite that never happens.
Exactly. Just the people, they don't connect that piece. And sometimes they say that, when I go to the doctor, because my background is I am a physician too, and just when I get patients one-on-one, and they understand what I am giving to them. But here is when you look at the population, people they are thinking, this is not my health. No, but this is your health. And also talk about the prevention side, because it's really difference between the more clinical healthcare than this one. Our whole focus is how we prevent the problem became a problem.
And sometimes people forget, prevention is our economy too.
Exactly.
It is highly. Public health has a big component of our economic well-being. So if we help prevent a disease, then your child is in school longer. They have a better education. And then also parents can go to work more readily, right? But if your child gets any of the communicable diseases like whooping cough, and they could be out for 21 days, what do two parents who are working or a single parent do, during that time? But if we can prevent that it never occurs, better education,
Yes.
better health, better overall for our economy. Same thing too. If you go out to eat, and you don't get sick, but you have a healthy environment, and so, but if you do get sick, how many days are you going to be out of work, those points and stuff.
And also that business, how that business will impact it as a restaurant. Just if you make the one person sick, then
multiple people might not come
you're
back to that.
economically
Yeah.
not in good
Yeah.
shape.
So overall, prevention is our big thing. And even in healthcare, a doctor knows that if a patient comes in, if I can prevent something in their care so they have a longevity, and they're not experiencing comorbidities or diabetes, or they can prevent diabetes.
Or quality of life.
Instead of earlier in 50s, 60s, but 70s, 80s, you're not dealing with those things. A doctor wants prevention, and so overall prevention is,
bottom line. But
Bottom line.
sometimes, again, because we are so focusing the prevention, we became invisible.
We became invisible.
That is, just and when we are talking about the funding and everything, it's like my example, let's cut the mosquito prevention program. But because we're invisible right now, because you are so successful, we don't have a mosquito bite anymore. But when we cut to that funding, that mosquito will come.
And a lot of public safety is the same, but especially public health. If we do our job well, you don't know we're there.
Exactly.
Yeah.
When there is a problem, it means that we didn't do well.
Yep.
Everybody hear us.
Yeah. And so that's a challenge. We're seeing certain dismantling of public health. And so if it's not easy, if you turn us off, it's not easy to turn us back on if you pause something.
This is exactly my question, especially right now with the misinformation, disinformation, what's happening in the nowadays. Just what is the impact? Really not just today, but what is the impact for the future?
So a lot of times our impact spans years, and so like if we were to stop vaccines tomorrow, you probably wouldn't see anything dramatic for a few years. But then as our numbers decreased of how many people were not vaccinated, in about 5 years, you would see the numbers highly increase. And then we'd be reactive, right? Instead of being proactive. So we're reacting to this. And that's never the best case on anything. That's why prevention is that. So we're being proactive toward many of those points. And so on some of the stuff, if we were to pause it, you probably might not see stuff for so many years. But then when it does happen, we can't easily just cure it because it's more systemic.
Exactly.
And so when you deal with anything system-wise, it's just like planning for your retirement. If you don't do it and then you retire and you have no retirement, then you can't do it in those moments. But you do 30 years of planning for your retirement, then you have it in place, right? And so it's all those same key principles. So that's the hard point, is that if we remove those things, you might not see an immediacy, but eventually down the road. And then then we have to go back and redo it all to get us back to.
Because sometimes, again, proactive and reactive version, just as a public health people, we are very proactive. In our life, we are trying to be proactive, just to plan and just make sure that always my kids is upset about you are planning a lot. But I'm trying to prevent the problem. When problem became a problem, it is more difficult for me to deal that problem. That is the biggest problem, I guess, what we are doing. But with this misinformation, disinformation also, is there any things as a public health we need to do more? What do you see as a gap right now, and what do you see our role in there?
So part of it, we do a community health assessment, and then that leads to a community health improvement plan. And so we do see a target for the first time. So we just completed our community health assessment, and economic stability was on there for the first time. It showed up in different ways, but it was a key component where individuals are concerned about paying their mortgage or being able to pay medical bills. And so, so the misinformation on any of those points or whatever, it's having how did we collect that information and how do we transmit that to the public? Now, sometimes, when you do data or when you analyze something, it just leads to more questions. But that's the point. We got to be curious.
Yeah.
How do we even, now we understand it at this point, how do we better understand it here if we did this? So a lot of times I think it's just how do we transmit that information correctly? And I think we have to be in the right spaces. I think we so if we're not in certain discussions, then it's a challenge, and that misinformation can grow.
Because I talked with a couple other guests, just when we have the science as a nature is changed constantly. Because you do something and you find something else and you are changing this, your results is changing. And that will give us an opportunity to act that way. I'm saying that, it's not just that this one is the exposure, but this one is exposure too.
Yeah.
But that also creating some communication issues, I guess, because it looks like we are changing our opinion constantly.
Yeah, it came down to it. I think we're still learning through social media.
That is bottom line. All of us
bottom
are
line.
trying
How we systematically, how we learn and how we digest is that. And so we also provide an open platform, and we're not curious enough. We see something, and if it agrees with what we agree with, we're good. If we don't agree with it, we either just that or we investigate. But sometimes, even if we agree with it, you should ask yourself, is that true? And let me go and research it and look at it. And I think that's where we miss sometimes. We've learned to accept what's put in front of us, and if we agree with it, we're good. But we should still even question it. That's science. That's just science. Science is just saying like, well, I know this, but let me make sure I know this, and it's always asking about the right questions and, and verify it. And I think we've missed that. Social media is it's so at the tip of our fingers, and we kind of have to relearn how to ask the correct questions and be curious.
And also how we can communicate more, just a more clear message. And, sometimes we are not doing the good job, I guess, that part.
We can learn from people that brand. There are
Exactly.
wonderful organizations out there that you just have to look at it and you know what it is and what they deliver. If it's from certain fast food restaurants to anything, they're great at branding, and that we could take lessons from them. And how do we better brand ourselves?
Trust,
and
soul,
build that trust. Yeah,
is very interesting actually.
Yeah. So when I was a child, so when I went to my mother, we'd go to our pediatrician. And he would just go to public health to get your vaccines. They have a greater quantity and stuff like that overturned, but they're experts. Go there, and stuff like that. So I remember that, there was that general trust, I'm a pediatrician, but I'm going to send you to public health because we're going to work together.
Yes.
And I think that's one point that we could do too, that I'm always interested in, is how do we better go back bridging the gap between doctors and public health? Because many times, what we saw during COVID was that if you have any questions, please consult with your medical provider. They know you best.
Yes.
They know your medical conditions. And yes, it's 100%. We see that. We need to bridge that gap better. So then our providers also know, well, what resources are out of me. I think where one point we could do is go back and rebuild our trust with our providers. So both public health and our healthcare providers are better bridged, and that may help on some misinformation.
Yeah, because it's that kind of how you can build the bridges between the many pieces. And I just want to bring back to us also, because I am academia, you are more practice and governmental, local government side, but we work together, you are mostly this video series specifically for our faculty and our school, how we can explain who we are, what is doing. But I invite you, especially connecting with the Public Health Week in April. So I want to also give that perspective that doesn't matter where we are in the public health. We constantly need to work together, and you are in our advisory board. We do many things, but just let's talk about it a little bit. How you see our role also as academia.
So your role I love, and so public health has been growing in undergraduate. which I think is amazing. So like I have problems, I have some challenges on being able to explain the scope of everything that I do as public health. Your scope is like 10 times bigger because, it's a platform for your students. And they go so many other places.
Different
They don't,
places.
you think like, oh, they're just going to go and work in public health, but they go to so many other places and they work in so many systems. One of your students last year I loved, it was different projects and they went about street murals and how it changed the community just by painting street murals, and it had just changed the whole aspect of the attitude of just that environment. And that's public health.
Yes.
Just having that mural instead of
Creating that
graffiti.
safe place, and
That's
just
public
that-
health.
Yes.
Sometimes we forget that and stuff. And so your scope, I love that they go out, and I love that it's becoming more popular or more just kind of that core because it feeds into so many different systems. So, I love that it feeds into my system because it gives me
Exactly,
some
workforce.
it gives me those people that are, epidemiologists and they work with numbers and they are amazing. But you also have this broad aspect, and even starting out in public health and going to medical school, I think is a wonderful course.
Because it's foundation.
It's a foundation and stuff. So I love how academia is growing on that, and I think you even have more of a possible larger reach. And I think we'll see an impact and payout from academia in the future.
But is it for futures and for the students' perspective, because they are coming to especially who is graduating in a couple of years, they are a little bit moral is down and a little bit, just what they are feeling is overwhelmed. And actually, two questions as a one. What is our public health workforce needs right now? What's happening? But also, who is coming as a graduate right now? What is your advice to them, and what they need to be careful about when they are choosing their road?
Yeah, when they're choosing their road, I think it's a little bit of self-discovery on those points, and it's a little bit scary, So in a specific job in public health, if we don't have an opening, we will always have openings to a point, in a career in public health.
If you have a population, if a human, we need it.
I would just be patient. Sometimes you have this idea of where you're going to end up, but allow yourself to be curious of like, where else can I explore with public health? There's a lot of doors. And so sometimes when there's a lot of doors, there's decision fatigue on your students. Like, where do I go with this? It's easier when you do a teaching degree or you do an accounting, exactly where you're going to end up. A teacher they know where they're going to roll. Public health, sometimes it takes a little bit of resilience to find your path forward. And sometimes it's easily definable, but sometimes it's not. So I would say be patient, but be open to possibilities. Because you now have been given the keys, or given the possibility to go and influence a system, even if it doesn't look like it's traditional public health. You could take a public health degree and go into politics. You'd think like, well, I didn't do a political degree, but you did a systems. You understand how a system works.
You can work for city.
You can work for the city. You can work in engineering.
Whatever.
So I would just take the time and be patient and explore those places. And the beautiful thing is too, you could follow a path and it will lead to somewhere else. Or you can go back and say, okay, I am going to get back into this track. So it prizes variability.
It is exactly resilience again. As we finish our tea and coffee almost together, what gives you hope for public health?
Which gives me is the community. They respond. And I think when it's given to them, they understand. And it's just getting to them and communicating. And then people that work in public health, they're amazing. You're amazing. You're always feel like that. Just as a community, and it just gives me hope is that it's always going to be there. And I think it's the people that work in those systems, they make impacts every day. And so it always gives me hope. Just seeing that one person who works in suicide prevention, they're one person, but they're making an impact that 40-year, that one cup of coffee. They do. And so that always gives me hope to see that, that like, hey, I made an impact on one person that really is going to make an impact in 20 or 40. you know, and stuff. So seeing the individuals that work in there and stuff, and as community.
Because the public health is really just, as a public health practitioner, they are really caring people. You know, just I always see that they really care about what they do. It's not just a job. It's not just the money. You know, just you do it for the like that. You know how I can make the bigger impact for the anybody, and the community is very important piece, and we need community support. And again, we know our role to how to build that. You know, just we need to build the you know, just the bridges. We need to build the trust and many other pieces. But community also, you know, just is important piece for us.
You know, I think I'm probably a little spoiled on some points when it comes to community. I think that gives me hope too, because wherever I reach out to, you know, it's like I'm like, hey, and they're like, yeah, let's talk about it. Let's entertain it. Yeah, is there? I've never had a resistance like, oh no. Like, well, even if the answer is no. But let's talk and see if there's something there that we can develop. And I think the doors are always open. So I love that about our community, that it's like, yeah, I've never really had that rejection in a sense, because it's always like, I think we can work together. Let's see what we can do. And that always gives me hope too. So
that is best answer again. But thank you so much for really joining me today. And it's really just having our tea and coffees together. It was really nice. Thank you very much.
Thank you very much for having me.
Thank you.
Yeah.